Hi everybody, Dr. Rob here, and we are ready to go. I'm excited to be here. We've got some great things to talk about. Every day there's new information to really share with everybody. I mean, we could be here for hours on end really talking about COVID-19 and all the other health implications and the things going on in the world. So for me, from yesterday to today, a couple people saw me fiddling with my face. I am battling a little allergy. Part of life, not a big problem. Just for my chiropractic brethren, I threw out a thoracic rib. It's hurting me like heck. Little trouble working out and things like that. But, you know, again, small little pittance compared to what a lot of people have to go through. I happened to be watching CNN just before, and I saw Chris Cuomo. He's the anchor, and he was talking to the CNN doctor, Sanjay Gupta, and he was showing him his lung x-ray. And they were really going through the idea. Of course, Dr. Gupta did a great job of not saying he was diagnosing him over the TV. He had looked at it on a screen prior. And they were explaining how in COVID-19, it can damage the lungs. And that was one of the things that Chris Cuomo was concerned about, that he didn't want any pneumonia, of course, but he didn't want any fibrosis or scarring in his lungs. So this is a very virulent virus, as we talked about. Remember, a virus is a pathogen. And I'm waiting for everybody to come in. I can see the views coming up right now. So today I want everybody, again, give me a shout out. Let me know where you're from. Let me know how you're doing. Ask some questions. We did a great job on doing that. I know the stuff I'm going to share today, you guys are really going to want to know more about. So I'm going to start with the update before I get to the antibody test for COVID-19. So I'm going to make you wait a little bit, but it's really good stuff. They had an article that came out on the mortality rate. Not the best topic in the world. And what they found out, this was from the state of Washington. In 9 different hospitals, they had 24 people come in that they had to put on the ventilators. And when they went on the ventilators, the mortality rate was 50%. So we're trying to avoid that. We want to help people, obviously, not get the virus, not allow the pathogen. Pathogen, what a bad word. I mean, it sounds like a robber, really. You know, it ruins your house, it eats your food, and then leaves. I mean, that's what the virus, that pathogen is. But with the ventilator, the average time on a ventilator was 10 days with these patients. The normal, pending on conditions, is on an average about 5 days. So they needed the ventilator much longer. If you've noticed in the news, Prime Minister Johnson, Boris Johnson from the UK, is now in the ICU, and they're making a clear distinction that he's only on oxygen, he's not on a ventilator. The most common symptoms from the people in this study that were on the ventilator were shortness of breath and cough, and fever, of course. So one little aside, like I said, I have the allergies. One of the big things you'll see is if you want to differentiate, or do you have low-level symptoms of COVID-19, not trying to diagnose anything. This was actually some of the doctors on the TV. And allergies usually have a runny nose, and COVID-19, you'll have a fever.
Creator Chiropractic said, become an in-hospitable host.
Yeah, I love that. Become an in-hospital host. I agree with that. See, everybody's blessed. I agree with that. You become an in-hospital host. We're going to really go, we're going to go into that. I just want to hold that thought for 1 second. Just want to close this loop. This is in New England Journal of Medicine, March 30th, 2020. Patients had underlying diabetes or kidney problems. Again, those people, for the most part, that are with the higher mortality rate are those that have those comorbidities. But that doesn't mean people who don't have them don't have tremendous issues, and there's been some fatalities in that. I think in some way the news did a little bit of disservice and said young people had nothing to worry about. They don't have as much to worry about as everybody else. And I always preface it by saying we're going to come through this. People are going to have antidotes, they're going to have answers. We've got some alternatives to keep your immune system strong. Speaking to the idea of inhospitable host. That virus does not want to stay there if it can't. It's very simple. And it's very funny that inhospitable host was a great segue when we really get into those antibodies, because that's our body's own part of our immune system that's trying to ward off what's going on. And some of the ways you can be an inhospitable host is, again, eat really good food, avoid your toxin load, keep your stress down now. Stress is so damaging to your overall health. And in addition to the stress, Make sure you're eating the good quality foods like we said, and that list, we'll list some immune boosting nutrients that I found to be really effective in general to boost your immune system. Data dictates that these are great for immune system boosting. Nobody's saying it ameliorates COVID-19. Want to be very clear. Here was another interesting article on the blood groups, A, B, and O. So O, as we all know, is the number one most popular. I think it's 45% of America has it, and A is around 40%. So there was 2,173 positive patients. This was from China, and blood group A had a higher COVID rating than non-A groups. The takeaway here was very simple. If you had O positive actually, but if you had O blood type, you were much better. You had a better outcome. You didn't get infected as much as if you had a type A. Now, some people have dispelled this study. It was published. It just recently was published on March 27th. You have to understand about some of the things getting published now. They're really not going through peer review because we don't have the time. They're just trying to get everything out, just try and help everybody. So peer review takes a long period of time. By the time they would give us this information, if it was truly peer reviewed, we'd be in multiple phases after this. So, you have to read it when it's over 2,100 people. To me, it catches my eye. So I think that's just something as, if you will, as an FYI. Do we have any other shout outs, or are we being quiet today?
Ellen says hi.
Hey, Ellen, how are you? It's good to see you. How's everything where you are? You told me you were going to call me.
Okay, go ahead.
That's it? Okay. Interesting. We came across this article in the Lancet Infectious Disease. It just came out on March 30th. And they believe, on average, only 6% of the actual SARS-CoV, COVID-19 infections have been detected worldwide. So what they're trying to say, quite obviously, is that there's a lot more people that are positive for it. Now, there are instances that some patients have called me and said to me that I'm tested positive, or my doctor says he thinks I'm positive, don't come in because I don't have any respiratory problems. And there's some people, 25%, that have no symptoms. So don't fret, don't run around. If you're not feeling that bad, don't worry if you have it or not. I'm a big believer in if you want to find out if you have the antibodies or not. Because if you have the antibodies, you have some built-in immunity. And getting to that, there is tests out there now. One in particular that I've recommended to my patients and my doctor colleagues is one that's a COVID-19 assay. So it looks at COVID is interesting in that it has 4 structural proteins. So whenever you look at that helix going like this, there's actually 4 proteins, and everybody always notices the spike. But the big thing is there's a little spike. There's a N protein also. That N protein is what you test for because it's the most common protein in the COVID helix with the spike. Did you want to let me know?
Crater says type O's unite. And Ellen Greenspan is sewing masks and she needs sewers. You can repeat that.
Say that. I didn't hear what about. So type O is universal. Let's go. Number 1. The boss is type O, just so you know, Dr. Powell. It's all right. I didn't release any real interesting information.
Ellen says she needs sewers to help her sew masks.
Oh my goodness, sewing mask. Well, sew one for me. I want a colorful one.
And any barrier is better than no barrier.
That's right. The key component is barriers. What's most interesting about the barrier is, they're talking about the distance, and it's in the breath. Now, there was an article that I just read about the aerosols. They're saying that it's conceivable that it's so big, the droplets, this is a unique virus, that it may pierce the mask, but go on the inside. But even though it pierced, it did not say that it increased the incidence. So the key is you need to wear the mask. You're not going to touch your face. You're going to keep your barrier. People, when we're outside, realize 6 feet means 6 feet. Just a couple of days ago, people in Central Park were playing basketball. They were playing Frisbee. My wife went shopping. It was a very orderly manner in where she went. They said 6 feet, and they were in their car. The people were handing the food, were all geared up, perfect in everything. And that's the way to do it, because right now our best defense is our defense. We don't have an offense yet. I'm trying to share some offensive things, but our best defense is us. an inhospitable host, like Dr. Powell said. It's us. So I want to get a little bit more into, yep.
Shanae says hi.
Hi, Shanae. How you feeling?
Hector Martinez, hello doc. Thoughts on supplements and herbs that can slow down the replication of the virus?
That's a great question. So thoughts, because sometimes I can't hear you, thoughts on herbs and supplements that can stop the replication of the virus. So didn't want to get off on a tangent, but I got to give you this. So they're looking at interesting, because this is going to talk about IgM and IgG. What you're going to see in the first 7 days of this virus is virus replication. So the first 7 days, that's why people don't get quite as sick, because the virus is replicating, trying to make its babies and do all this. By about day 5 to 7, that's when that cytokine storm comes in. That's when all these cytokines come in and start trying to kill it and attack it and can't. And if we have an aberrant immune system or we're too elevated in inflammation, that's why that cytokine storm is too much for us. So the first 7 is viral replication. The next 7, damaging to the body, is without question the cytokine storm. And the cytokine storm is the key, how our bodies respond with that. You're looking at Chris Cuomo, using him as an example because he's on national TV all the time. You're seeing that he's managing his cytokine storm, managing it enough that it's not breaking anything. But boy, oh boy, he said he doesn't feel too well. And, again, everybody readily admits that he's a fit 49-year-old with access. He is the governor of my state's brother. Did you have another?
Shanae answered you. She said she's doing fantastic, just a recurring headache.
Okay.
She feels good.
Great. Now, I don't know if she was tested positive or they just told her to stay home. But again, when we can complete the antibody test, she may be a good candidate just to see what she has. I'm happy you're doing better. Now you can get and do your workouts that you love so much and everything like that. And everybody also, every day, don't forget that we're going to be here at 1 p.m. on every weekday Eastern time. And we're also helped and sponsored with Creative Chiropractic in Medford, Oregon, with Dr. Warren and Dr. Powell. They do a great job of sharing their patients. We have some other doctor clinics that are tuning in today. They told me they were going to do that. And that's great. Let's share the information, shout it out, ask a question. I'm in no rush. I got a lot of time here.
True wants to know, what about using the expanding lung mask?
The lung expand, I don't know much about that. I'll have to get back to you on that. I don't know about the lung expanding mask. We're good?
Yeah, Henry from Gabrielson from Nutridyne. Say thanks for all your hard work.
Henry, how are you? I need to give you a call. I promise I will. I'm happy Nutridyne. None better than Nutridyne. They do a great job in the supplement. Anybody that needs anything from Nutridyne, just reach out. Got a great Nutridyne store. Greg Peterson is a personal friend. And Henry does a great job on the marketing and social media. So let me know. We're good? Terrific. So let's talk about IgG and IgM. So what are they? What's an immunoglobulin? What's our immune system? Let's keep it nice and simple. We have an immune system. An immune system is our defense barriers. We have an innate immune system, something that we got from day one. We have an adaptive immune system, that's something that the body created very smartly about 10,000 years ago. So our initial defense is our barriers. People don't realize skin's a barrier. Our gut's a barrier. Our blood-brain barrier is a barrier. We have barriers. We have barriers to our lungs. We have a lung barrier. Our gut and lung barriers are almost the same with their bacteria. So there's a direct correlation between our gut and our lung. After our barriers are pierced, that's why we talk about barriers with the virus. Wash your hands, because it gets inside your skin, if you will. It gets in your eyes, gets in your mouth, gets in your nose. That's why they're testing for your nose and your mouth. They say the mouth thing in the back of the throat's a little uncomfortable, and it can get to your lungs. It also damages your gut. And the reason is the same receptor sites in your lung, your liver, your kidney, and your gut, they're all together. They're all the same. Having said that, your body wants to attack it. Your immune system says, is it self or foreign? Now, this virus is clearly a foreign. We call it a pathogen because the body's never seen this genetic sequence before. So when it comes in, we want to get our immune system activated. So initially, our innate immune system comes. Our innate immune system consists of, in addition to the barriers, it consists of what we call natural killer T cells. there's natural killer T cells, there's something called secretory IgA, which is in the mucous membranes. We have that in our lungs, we have that in our gut, etc. And that comes out. If we're not able to ameliorate it and relax it, we now need to call on what we call our switch to our adaptive immune system. And that's where immunoglobulins come in. And immunoglobulins are, the attempt to make antibodies. So when you think about it, they want to make an antibody. When we can make these antibodies, we're making antibodies. They're like soldiers to protect us from the onslaught. Some of the bigger antibodies, if you will, or the two of note, are IgM and IgG. IgM comes out at an acute inflammation. It's early. It's like day 1. IgG starts at day 5, but it's chronic over a long period of time. IgG is very unique in that it's 75% of our immunoglobulins, and it's something that can pass the placenta. That's why they're thinking that the pregnant woman could pass it. They said could. There's been some instances, could pass it to the fetus. So we want our immunoglobulins. So if you were to test and to see you've expressed immunoglobulin to this specific virus, you know that you've probably had it and warded it off to a certain extent. It does not ensure permanency against it or permanency against the second attack. What we think, what we've heard, again, not medical advice, is that it means you won't get it for a little while, but it's really good if you have the antibodies. A couple of my friends are working in the medical, they're on the front line, and hats off to them. Anytime they want an organic coffee, it's on me. And they've taken the test, and for them, they for whatever reason, they don't have the antibodies. They haven't got attacked yet. Others who've had it, who got the antibodies, are like high-fiving each other because they feel it's a good thing. At least they have some innate defense against it. I see that we have some questions.
Shirley wants to know, should we drink an extra type of hydrate except water?
Absolutely. So here's some things I would recommend. Water, of course, is great. As you said, nice call. Organic coffee, green teas are really good. A lot of polyphenols. And, an electrolyte drink like Hydrate, will give you the link from Nutridyne. You can go get the Hydrate on my store. Things like that are great choices. So getting back to those immunoglobulins, IgM and IgG, they've created a blood test. There are several, but this is one that works very nicely. It is in FDA clearance approval mode. We'll put the link. Let me know. Would you like the link to order the test? If you would, say link. And if you do that, I'll come back in. We'll put it in. Just say link if you want it, or you want your doc to do it, or if you need me to do it for you.
Jennifer Morgan wants to know, should someone with SIBO still take probiotics to heal the gut, or should they take a round of antibiotics first? I hear conflicting advice.
Okay, so I'm going to answer that when we're done with this. That's a great question. So that's SIBO and antibiotics. Not a problem. So I have a little thing why we test for IgG and IgM. I kind of spoke about it before. Let me give you some data on the test. The data was done in research was done in 5 institutions. There were 447 tests. And I don't want to, specificity and sensitivity. That gets a little confusing. The data on this, the clinical data on this test, it was like almost 2 million kits, was there were no false negatives, and it's about 87.3% avoiding what we call a false positive. So the numbers are really robust. So hopefully we'll get it. It's a serum test. So can you pass me I'm going to show you what we got in the mail. And what we got in the mail are 2 vials. They're 10 milliliter vials. You can toss it. Right. So we got it right over here. And in there are the 2 vials. And you can see that we have 2 10 milliliter vials. So what I'm going to do is, we're waiting for the phlebotomist to call us, and they're going to drain my wife's and my blood. We're going to meet them outside, so we'll meet them in a driveway. They'll be geared up. I'll wear a mask. I'll wear a short sleeve shirt, put my arm out. They'll take it. See you later. Same for my wife. If it's bad weather, we'll meet them on the porch, whatever. But we're not going to let them in the house. Not that I'm afraid. I just, they're going to different people's homes. They're doing the best they can. And they're going to probably wear all the hazmat stuff. So we'll meet them outside. My suggestion. So if you're interested in the test, press link. And my code is, and I'll give you the code. You need a code to get in. It's COVID-19 / excuse me. Let me say that again. COVID-19 / Dr. Rob KBMO Diagnostics. So I'll give it all. I'll put it in. Are they asking for the link? Okay, so I will add the link. I made you watch everything. And we'll put that at the top. We'll put the link in. You can do that. Not a problem. James White's the CEO. He's a good guy. And if you have any questions, email him in. Again, if you need me to help you get the test, we'll get that for you. If not, we'll give you the doctor code. Practitioners, reach out to me. We'll help you out. DM me, practitioners. So did we just have that one question at Jen Morgan? Nothing on the test, right? We're just getting link. How many people want that link?
Only 2 so far.
Oh, I'm a little disappointed. We just did an email to our local neighbors, and they were all jumping on it. But that's okay. So let me answer the question for Jen. You know what? Let me say why you want those. You want to know if you have the antibodies. So it'll mean that you had it over a duration of time. So it's a good thing. So for Jen Morgan, she asked about SIBO, which is small bacteria overgrowth. You know, we kind of go back and forth a little on this. Again, I can't comment on antibiotics because it's medicine, but I do a SIBO protocol, and we've got some good results with SIBO. If you're interested, reach out. Obviously, if you take antibiotics, it kills all bacteria, so you may have a perpetuating problem within the SIBO, and the problem with SIBO is it has a high reoccurrence rate. Remember, if you have SIBO, you can have leaky gut. If you have leaky gut, you don't necessarily have SIBO.
Shani wants to know, liver and lung recovery, how does that work? Heard the virus can cause some damage.
Yeah, the virus, from what we're reading and what we're hearing, can cause some damage to the lungs. So, you know, you'll need a lung x-ray if you're concerned, because, you know, you're concerned that you may have had it. You may have been positive. All right. So, again, anybody interested, I'll share the link. Every day I'm on 1 o'clock, Monday to Friday, Eastern Standard Time. Feel free to reach out, say hi. Feel free to ask a question. Feel free to have a comment. Practitioners, if you need help, you guys know how to DM me. So once again, I want to thank Creator Chiropractic today for helping us out. Great job. I want to thank KBMO for supporting us. I want to thank Nutridyne Arconia and everybody else who supports us daily in this trying time. I'm going to be on a webinar today at 2 o'clock. We've got a lot of people on exercise and rehab through Web Exercise in Arconia. I'm excited about it, and hopefully some people can join. Everybody, it's been my pleasure. You know, Jim Rome says, take care of your body. It's the only place you have to live. Dr. Rob Silverman, always yours in health.